And now completing neurotoxic snake bite, we have the hemotoxic snake bite envenomation. The two major of the big four includes your viper group. So your Russell viper and saw-scaled viper, right? This is Russell viper and saw-scaled viper. So here the hemotoxicity, the procoagulant enzyme is going to result in consumptive coagulopathy. The hemorrhagens or the zinc metalloproteinases again is going to cause spontaneous systemic bleeding. So the victims with envenomation can present with visible systemic bleeding, like they can have bleeding from the gingival sulcus or from nose, that is epistaxis, or they can have ecchymosis, they can have hematemesis, vomiting, hemoptysis, there can be bleeding per rectum, they can have conjunctival, subconjunctival hemorrhages, chemosis, or continuous bleed from the bite site, or bleeding from pre-existing conditions like hemorrhoids. Okay, so from all the orifices they can bleed, and they can have bleeding or ecchymosis at the injection sites. The skin and mucous membrane can show evidence of petechiae, purpura, ecchymosis, bleps or gangrene. The patient usually we said viper have local manifestations. So the bitten site can be swollen, there may be local pain, and patients who are presenting with acute abdominal tenderness, sometimes they present with abdominal pain and tenderness, you should always suspect an internal bleed. Just like you have an overt bleed, they can also have an internal bleed. So think of gastrointestinal or a retroperitoneal bleeding in a patient who presents with acute abdominal tenderness, hypotension or shock in case of a hemotoxic snake bite. Some patients can have an intracranial bleed also. So they can present with lateralizing neurological signs and symptoms like asymmetrical pupils. So that may be suggestive of an intracranial bleeding. Some can have even subarachnoid bleeds. They can present with neck stiffness. Okay. So these are the manifestation of a hemotoxic snake bite. So there is continuous bleed from the fang mark, from the bitten site. They can have epistaxis, and viper, especially viper, can have a bilateral parotid enlargement. This is called viper head appearance. So this person is bitten by viper and it's called a viper, the triangular head, viper head appearance because of the parotid enlargement can occur with Russell viper bites especially. The patient can have gingival sulcus bleed or gum bleeds. The patient can have local manifestations, local swelling, contusion, ecchymosis at the bitten site, and this is chemosis and subconjunctival hemorrhage. And this is a child who is bitten by viper. The patient has neck stiffness because of the subarachnoid hemorrhage. And see, they can have intracranial bleeds, the intracerebral bleeds like this. Okay. And some patients can have even hematuria, brown urine, hematuria again. So that is about the hemotoxic snake bites, which are viper bites. And now coming to the myotoxic snake bite envenomation. Though rare, it can occur, especially when the fisherman handle the snakes which are caught in the net, etc. Otherwise, it usually doesn't come and bite. So this is myotoxic envenomation is seen with sea snake bite. So patient can present with muscle ache, muscle swelling, involuntary contraction of the muscles. And the patient, because of myoglobinuria, the patient will have a passage of a dark brown urine. Again, this bite can result in a local compartment syndrome. And because of the muscle breakdown, there is release of your potassium, hyperkalemia, rhabdomyolysis. All this can result in cardiac arrhythmias and acute kidney injury. And subtle neurological signs, neuroparalysis can also occur in case of a sea snake bite envenomation.